The opioid epidemic has affected my community in a lot of different ways. It's a tragedy.
No one should die from an opioid-related overdose. We know how to intervene and save someone's life. We know how to treat the underlying condition of opioid use disorder. So it's really an example of how we haven't had the will to mount a response that meets the needs of the current crisis.
The Shift Care program was offered as a challenge to clinical systems throughout the state to see if we could do better vis-a-vis patients with opioid use disorders that were presenting in the hospital.
Funding supported 9 hospitals to be able to offer immediate access to medication treatment for opioid use disorder in the emergency department, link people to ongoing care and bridge clinics, and to build in peer recovery coaches as a part of the healthcare team.
But what wasn't working is that we weren't reaching the patients where they were at. And where they're at is in crisis. And that's where the Bridge-In Clinic and our approach, meeting them right in the emergency room and saying, you can come and see us today, tomorrow, right now.
The idea was to give those patients easy access to treatment, quick access, and a quick referral to outpatient services. Whatever work was started in emergency room, we were able to pick up on outpatient basis and work with those patients in the community.
When I got to the ER, I just knew that I was at the end of my deck. I got hooked up with a real good doctor that day, and I was able to tell him everything and be honest with him about my drug use and my addiction. He was just the nicest person. 1, he made it easy for me, and 2, he didn't judge me. And from there, it just was golden, I'd say.
Our patients are very much the ones that fell through the system. We see people that are at their lowest low, and oftentimes we forget that there's a person in there that has so much to offer. They just want hope, and there's nothing in this world that can change their mind outside of somebody caring.
I feel like with Brian in particular, he didn't make me feel uncomfortable, he didn't judge me. With somebody that you know that's been through it, and they can give you real insight, advice, they can relate to almost anything you say, and they can also help you come up with a solution at the same time, all while not judging you. I feel like that's a recipe for success.
My role as a recovery coach is to meet with a patient and work with them on a peer basis in order to help figure out what social barriers are preventing them from a successful recovery.
Bringing in peer recovery coaches has been hugely transformative. We often talk about them as being the human glue of the work that we do, because not only do they provide invaluable care to patients, but they also are sort of a living, breathing reminder every day that most people recover.
The difference that they make is that they're in recovery themselves. They've been in recovery for more than a year, and they have been trained to be able to help their peers.
Here, we bring our coaches in as full employees, fully trained and oriented to hospital practices, and yet they retain this other special contribution in their awareness of our community and what it means to live with these problems.
A doctor's always going to tell them, just take this medicine and you'll feel better. They know what's available, but if they have their peers that are on their level telling them, they listen.
I can recall back to that day where I had Suboxone in my left hand and I had two pills of oxycodone in my right hand, and I decided to go with the medication, and from there it's been quite a journey. And I remember texting Brian roughly about an hour or 2 hours after, thanking him that I felt like that was just the start of it, and I felt like that was my breakthrough moment.
Sometimes I can get people to talk to me that wouldn't normally engage with anybody in the medical community. And if I can break down that barrier this week, then who knows what will happen in the months to come, years to come.
A lot of patients say, this is the first time I feel like I can do this. This is the first time that I feel like maybe, just maybe, I won't die.
We can do this. We can creatively respond to a public health crisis and meet the needs of people across the full sort of spectrum of who they are. And the real need is that we have the will to do that in the context of overdose.
I don't think we're ever going to cure or eradicate addiction, but I think we're going to see far less overdoses. And for every person that doesn't end as another fatal overdose is another person that is potentially getting their life back.